The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show, we'll be talking about Medicare. And in particular, we'll be talking about what we call SHIP counselors. They're the individuals throughout the state that can help you with anything on Medicare, including fraud, which we'll be talking about. You just signed up for a new Medicare plan. How is that working? We'll talk about that and how to evaluate it, so stay tuned.
Benefits can be complicated. Getting help shouldn't be. Montana Veteran Service Officers offer free, confidential assistance to help veterans understand and receive the benefits they've earned, state, federal, and beyond. There's never a charge, only support. Connect with your local VSO today. Call 406-324-3742 or visit veterans.mt.gov. Montana Serving Veterans.
Brought to you by Montana Veteran Affairs Division and this station.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
Hey, caregivers, did you know that respite time is your time? How will you spend it?
How about some good old-fashioned me time for starters?
Michelle Smith, Helena.
Or maybe play a high-stakes game of volleyball with my other kiddo. Gotta teach him who's boss, you know? I could even make my famous spinach lasagna. Never hear any complaints about that.
Montana Lifespan Respite. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Hey, Mom. More lasagna, please?
Sometimes the difference between having the life-saving medications you need and going without is the premium on your Medicare drug insurance. If you're a Montana resident enrolled in the Medicare prescription drug program, you may be eligible to receive help with your premiums, even if you own your home or other assets or think you may have too much income. Call or visit the Big Sky RX website today to find out if you qualify.
There you go, ma'am. See you next month.
Thank you.
Hello folks, welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services, Senior and Long-Term Care Division, Aging Services. I'm your host, Brian Lamore. We're talking about Medicare today. It's an ongoing program, and we find that individuals might need a little bit of help with their Medicare throughout the year on varying issues, including fraud. So we'll be talking about that today with one of our experts out of Area Agency 8 in Cascade County. That's Pamela Roach. You're a SHIP counselor. Welcome to the show, Pam.
Thank you, Brian. Nice to be on today.
That's great. Well, let's kind of start at the top. Let's first say what a SHIP counselor is, because you're a SHIP counselor.
I am. So SHIP is the acronym SHIP for State Health Insurance Assistance Program. And that's people who have training in Medicare, helping people with Medicare.
Mm-hmm. And just about any issue that comes up, you can help them out. But let's start at the top. People might know the word Medicare, but they might not know what all it means. But there's some ABCs to it. Please explain them to us.
There is. So Medicare is AB. There's also C and there's D. So it's a bit of an alphabet soup. So Medicare Part A is your inpatient hospital coverage. Part B is your doctor's visits, tests and procedures, outpatient hospital, and durable medical equipment. There is a Part C, which is an advantage plan. So if someone says, I have C, they also mean they have an advantage plan. And then Part D is prescription or drug coverage.
Mm-hmm. And when does one become eligible? How can one sign up? Can just anybody, anytime?
No. there are guidelines as to when you can sign up. For most people, if they're coming up to their 65th birthday, they can then enroll 3 months before their birthday, the month of, or 3 months after their birthday, in order to get their at least Part A started. It's all dependent on if they're retired, no longer working, no longer have any kind of employer's health insurance. They want to get that A and B and then get the Part D. And then if they are working, they can go ahead and enroll into Part A. And then if their insurance is creditable, C-R-E-D-I-T, creditable means does your employer's plan pay as well or better than Medicare, particularly when it comes to prescription coverage. And if it does, then you can delay your enrollment into Part B and Part D.
Mm-hmm. That's great. Now, you're a SHIP counselor, and we'll have an 800 number on the screen a number of times during the show, and people can call that. What do they typically call you about? Do you have a kind of a most popular question?
Probably the biggest question is, how do I enroll into Medicare? Mm-hmm. And then it would come up with, are you retired? Are you still working? And then also you can come to Medicare after being on Social Security disability for 25 months. And then for those folks, they will call me and ask, what else might I need to get enrolled into? And then that's usually the Part D part that we talk about.
Mm-hmm. So when we talk about when they become eligible several months before and after their birthday, how do they take the first step to sign up for Medicare and, importantly, pay for it?
Well, there are a couple of options. You can create your Social Security account and enroll through Social Security online, or you can call one of your SHIP counselors and we can help with the enrollment. I do those often. It's a very short online application. It's the first step to getting enrolled. The person who does the online application then gets the official application, if you want to call it, in the mail from Social Security, and that's the one that they have to sign a date and get back to Social Security to start the enrollment process, or to get it finished, I guess.
Okay. Now, I think it's important to note that our SHIP counselors are all in Montana. And they don't have anything to sell that's off the shelf because you're publicly funded, right?
Yes. We have federal funding. We have a little bit of state funding and a little bit of local funding. For our agency, we are part of Cascade County, and so we are a government entity, but a lot of the other SHIP counselors and the agencies on aging are nonprofits, and so they would get their funding probably generally through the federal programs. For a SHIP counselor, we're here to give you information. We're a neutral third party, if you want to look at it that way. We are going to say these are your options, but you, as the person who is enrolling into Medicare, particularly prescription plan, then you get to make the choice of what you want. Now, when you're enrolling into A and B, there aren't any other options because that's the federal health insurance coverage. But then going forward with the prescriptions, you do get that chance to look at what's out there.
Okay. Now, when you become eligible, you're over 65, sometimes people might need a little help in figuring out their Medicare. And how do they get help beyond you? Would it maybe a loved one or?
Sometimes they do turn to family. If they're comfortable using a computer, that they can go to Medicare.gov website, and that'll show them plan options. Sometimes they will go to a presentation. As a SHIP counselor, we can present out into the county. It could be a senior center or an organization that invites us to speak on Medicare.
Okay. And does your local area agency have a website that they may be able to go to find out those sessions?
We have our county website. We don't have a Medicare or SHIP I can't say that word. I have to cut that one out. Oh. Specific website. Medicare.gov is the most specific. For our website as the county entity, you can just go and see what programs the whole county offers.
Okay. Well, we're going to be right back after these few brief messages, and we'll talk more about that, so stay tuned.
The human heart. Even at its strongest, it's a fragile muscle. Chest and arm pain, shortness of breath, are signs of a heart under attack. But 3 numbers can save a life. Dial 911 at the first sign of a heart attack. Quick response from medical experts can save your life.
I was 45 and it happened to me, a heart attack.
Dialing 911 saved Ryan's life. Now he's here and he's healthy.
This message sponsored by Mission Lifeline Montana.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Can you say ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
Welcome back to Aging Horizons. We're continuing our talk about Medicare and how we have resources throughout the state of Montana that are located here that are ready and willing to help you on any issue you have about Medicare. Rejoining us is Pam Roach here, a SHIP counselor out of the Area Agency 8 in Cascade County. Now, Pam, we talk about Medicare and we've all been getting those calls. I'm from Medicare. I'm here to help you. Give me your number. I don't have it. That's fraud, isn't it?
It is. If anybody says they're from Medicare when they call you, that's a big red flag. It's probably a scam call. They're looking for your Medicare information so that they can bill Medicare for like durable medical equipment or something so that they can get funds from Medicare that are not something that services that you had ordered or something that your doctor had ordered. So Medicare does not cold call, and neither does Social Security. So if you get those calls and they say, "Hi, I'm from," hang up. You don't have to visit with them. You don't have to tell them that they have the wrong number. You don't have to tell them that I won't give out their information. They'll keep calling, unfortunately. But the more you ignore the number, the likelihood that the frequency of the calls are going to decline. Can't say they're going to stop 100%, but a lot of times people will start those calls with, and hi, how you're feeling? I'm with Medicare. I can give you, a free elbow brace or back brace. Just give us your information. That's another big red flag. As soon as they want more information that's personal, then you want to end that call as quickly as you can. Now, sometimes the calls will come up if you have caller ID on your phone that it looks like it's a number from Montana. That does not mean that caller is coming from Montana. They may be spoofing the number, meaning that somehow they've been able to use a local phone number, and often these numbers are not in use, to be able to make these calls, blocking where they're actually calling from.
Yeah, I know that's one opportunity I have not to be nice when they call, because they're trying to basically steal from me and you. And they are very good at what they do. They're very friendly. Don't even get into it. Just hang up right away. And you don't have to turn them in. I mean, these fraud people, they take the money and they're gone so fast, it's hard to get it back. But our SHIP counselors help to address that. And where is the first indicator that an individual would see that possibly there's some fraud going on with their account?
So a lot of times when you receive your, if you're on Original Medicare, you'll receive a Medicare Summary Notice, or MSN. And if you're on an Advantage plan, you will receive an EOB, which is an explanation of benefits. And that outlines who you went to for appointments or hospital stays, what was done, the dates, the location. And when you start reviewing those summary notices, if you see something that really jumps out at you, like durable medical equipment that you might not use or need or have been prescribed by your doctor. If it's an appointment that you've never been to a doctor or a location that you've never been to, those are big red flags as to this is fraud. Someone has gotten a hold of your Medicare information, has billed Medicare for something that you did not need, you did not attend to for an appointment, your doctor did not prescribe. That's the first line of defense, to review those summary notices.
Mm-hmm. These people are pretty sneaky, I'll say. They know your name, they know the last 4 digits of your Social Security number, they know the town that you're in, but they don't know the Social Security number, and they say they are your Medicare provider, and they are not. When you get the explanation of benefits and you go down the line, they don't know who your doctors are. So most likely there'll be a strange doctor there from a strange appointment. So if you don't recognize the name, contact you guys, right?
Yes. And so we can review those summary notices with people. And a lot of times, if it is an appointment, it's going to be an appointment in another state that you probably have never been in. It's not like a hospital visit where a specialist maybe reviewed your information. So that's a little bit different situation. But if it is a visit for, let's say you had a broken toe in Kansas City, and you've never been to Kansas City, whether it's Kansas or Missouri, that's definitely fraud. More often, though, we see it's durable medical equipment, DME fraud, where, again, if you had gotten that phone call and someone said, let us send you a knee brace at no cost, that is not something that you want. Sometimes the items are sent, sometimes they're not. Oftentimes they're not items that you would use. And then also with that, Medicare does a 5-year look back. So if they have sent you something, the scammers, Medicare has paid for it, you go to your doctor, let's say your doctor says now you need a special knee brace. If Medicare has paid in the past 5 years, they'll say, okay, we've already covered this once. This is still within the 5-year period. You're going to have to pay for that out of pocket. So you end up getting defrauded, and so does Medicare.
Oh boy, they are sneaky, unfortunately. But the area agency is here to help you, and they can help you in many different ways, can't they?
Yeah, so I've had clients come in, we sit down, review those summary notices, and we do report to Medicare that this person has been billed for these items or this item or this visit. And then Medicare will take that information and escalate it as a fraud report.
Okay.
And same thing with Advantage plans.
Yeah. Well, we're drawing to a close so quickly on this segment. We have one more segment left, but we'll talk more about Medicare and how you're an important component of the system, of course. So stay tuned. We'll be right back.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Medicare loses $60 million in Montana each year, $70 billion nationally. Medicare processes 4.5 million claims a day. They don't know who your doctor is, but you do. Mistakes can happen.
Read your Medicare statements and call Montana Senior Medicare Patrol if you see anything unexpected.
1-800-551-3191. This project is supported by a grant by the Administration for Community Living.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
I was angry and upset when the doctor told me I have diabetes. I just didn't want to deal with it, the needles and the diet restrictions. But after I started to learn about it, those feelings changed. I was at risk for a heart attack caused by high blood sugar. That got my attention. I started watching my diet and making sure I got enough exercise every day. I want to be around for my grandkids, and now that I know what to do, it seems like a small price to pay.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. We're continuing our discussion about Medicare. In this segment, we're going to kind of focus on our area agencies on aging. They're located throughout the state of Montana, and although you might not have heard that name, what they're famous for is senior centers, Meals on Wheels, and advocates for individuals in nursing homes and legal services. And Pamela, you're part of this system, aren't you? You're with an area agency, so you know firsthand how they help. Please go over the services that are available through the area agencies.
Well, for us here at Cascade County Aging Services, we're located in Great Falls. We have our Meals on Wheels program. We have a transportation program, and that's just during the week, 8 a.m. to 3:30 p.m. We have a home attendant program where we have some of our employees who can come in and do a little light housekeeping. Our agency does not provide any personal care. That would be an in-home care business, so that would be completely different. We do have a foster grandparents program where you can go into the schools and help the kids, usually in elementary, with reading and math or whatever the teacher wants. And then, of course, we have our SHIP or Medicare programs here. Many agencies also have these same programs and may have additional services depending on their location.
Mm-hmm. And I think the one thing you didn't mention was information, referral, and assistance. Can you kind of explain what that program is and how important it is?
Well, and that's one of the hats that I wear. So for information and assistance, what I do is that if someone calls in and they're looking for a resource or they need a number for another organization or they're looking for an answer to a question, but they're not quite sure where to find the information, and they call us, then we can provide phone numbers. I do video or online searches. We try to find the information and the connections that they're looking for. Sometimes the best thing we can do is just say, talk to the folks at another organization.
Mm-hmm. So you can link them up or tell them what direction to go with that. But now you also mentioned Meals on Wheels. I think everybody's heard that term, but could you define it for us so we really know what it is?
So for us, it's a Monday through Friday meal program. We have a kitchen and they provide the food. They cook the food, they get it sealed. We have drivers who take the meal out. It's delivered anywhere from like 10:30 to 1:30, depending on the size of the route. We have several routes here in Great Falls. We serve around 400 meals a day. And so we have the need is for anybody who cannot get out of the home, who's at least 60 and over, and does not have family support who can help them prepare a meal or shop. And so at least they would get one meal a day to their home. And so at least they're provided some kind of nutrition. And it does follow federal food guidelines, so it is a nutritious meal.
Mm-hmm. And we have senior centers, and what's really important to seniors is actual socialization, getting together with other people. The senior center will offer a number of different types of services. Can you explain the senior center to us?
So we have one here in Great Falls, and they do offer a variety of programs. You could do pool, you could do woodworking, you could do dancing, exercises, bingo, card games. They have a variety of activities. Our Great Falls Senior Center is a little unique because they do have their own kitchen, and so they do serve their meals. That is you have to pay for that. But our other, we have 4 other senior centers in our county. We have Centerville, Belt, Cascade, and Sun River Valley Senior Center. That's in Fort Shaw. They are our congregate meals selection, or okay, let's cut that. Let me try that again. They are our congregate meal centers, and they would provide a meal. Sometimes it's a couple of times a day. Okay. Sometimes they provide a meal a couple of times a week, or it's every day, Monday through Friday, just depends on the center. If you are a member, you do have to provide information, intake is what it is, to get signed up for that meal. But if you're 60 or older, you certainly are welcome to enjoy the meal there. And they often also provide activities, might be card games or bingo or something like that.
Mm-hmm. And I know they also have an ombudsman program for nursing homes. Could you explain what the ombudsman program is and why it's so important?
So Great Falls doesn't, or I should say Aging Services does not have the ombudsman program. That's through Nichols, North Central Independent Living Services. But the purpose of the ombudsman is to go into assisted living and nursing home or long-term care facilities and visit with the residents about their rights. If they have issues or hoping someone can help them mediate an issue, the ombudsman can work with that person, but only if that person gives them permission. You know, if a family is upset about an issue going on, if that resident doesn't want to address it, the ombudsman doesn't do anything but just listen and then let the family know options that they might be able to use to help them mediate. Mm-hmm. But the ombudsman is only basing on what the resident would like to do.
Okay. And you're the kind of entry level, being information and referral to aging services, right? That's available.
And there have been times that we can say that as an ombudsman issue because of the facility they're living in, and then we can provide that number. We don't get those calls as often as we do because we don't have that program, but every once in a while someone does ask us, who do they reach out to? And we certainly do provide that number.
Okay. Well, we've drawn to a close on the show, Pam, and thank you so much for helping out and addressing the issues and the needs for our seniors. And for our audience, we'll see you again shortly.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.